AIDS has become rampant in today's society, yet there is a very simple way to prevent it. According to the sexedlibrary.net, with the practice of safe sex, contracting diseases of any kind are instantly dwarfed in probability as opposed to no condom use. The HIV virus can remain dormant inside of its host for up to 10 years, which could result in carefree, unprotected sex, because the carrier has no knowledge of what they have. This results in furthering the cycle by the spread of this vicious and incurable disease. In Africa, one can see that the disease has spread like wildfire. UNAIDS has collected statistics that report over 20 million people located in the African sub-Saharan suffer from the HIV virus, with roughly 33 million confirmed cases in the entire planet. Africa accounts for 2/3 of the carriers. In the year of 2009, over 1 million AIDS-related deaths occurred here. In America, of the 1.5 million cases, there were only 25,000 deaths. When one acquires HIV, if they live in America, they are exposed to the best available resources to help live a much longer life than if there was no treatment whatsoever. According to MayoClinic.com, most people who contract the HIV virus generally have flu-like symptoms, like fever, sore throat, skin irritations, and swollen lymph nodes. Either a lack of attention to one's body or a lack of severe, long-lasting symptoms is what I believe leads to a lack of diagnosis. The HIV virus infiltrates one's body and attacks the antibodies, which help our bodies fight off disease. This, in turn, makes the most elementary of diseases deadly. It's a harsh reality that we live in, that diseases are still so elusive that we cannot develop a cure with such advanced technologies in medicine. Not only does being diagnosed with the HIV virus mean that one would inevitably have a whole new level of stress added to their lives because of the constant reality of death, but also they have to deal with the less than accepting views that society has given the infected. HIV patients are often viewed as lepers, by which I mean they are complete social outcasts, and many face open discrimination from this stigma on a day-to-day basis. These folks that are suffering do so in a way that is completely unique to only very few diseases. For example, if somebody develops cancer, they will be met with pity and full support from those around them in a home and social aspect. However, with HIV, people feel compelled to not reveal their illness to anyone because of strong feelings of shame. Other than living with this burden, the HIV infected also deal with heavy levels of psychological damage as well. If one has a life-threatening disease, it should not matter how it was acquired, but rather we should focus on giving anyone moral support who is in need for it. I cannot imagine a better situation to provide comfort than when someone's life is in danger. While opinions of HIV have changed over the last decade or so, people with HIV still believe that they will be socially exiled due to their disease. As the virus has left the gay community and has become a factor in everyone's sexual life, it has become harder for individuals to discriminate by the larger and larger numbers of people infected by the virus. It's a shame that it takes many deaths to create acceptance in this part of the world. Sometimes it takes a lot of death to change an opinion in this country, and this disease is no exception. Hopefully, as a species, we can learn from these cruel mistakes. If we plan on living in an accepting society, then this must change, but there is yet to be a clear solution that everyone can agree upon.